Yeah, student, good morning. Today I'm going to explain about lecture 23 of Unit 3. The topic is very interesting and easy topic, hemophilia. So, hemophilia, what is hemophilia? It is also called as bleeder disease. Another name of hemophilia is a Christmas disease, or also it is called as royal disease. Why it is called as royal disease? Because it was found in England. Queen Victoria, she was the carrier of this hemophilia. Then it went to her son Leopold. Then that way it and he got married to some other country. That's way it is spread to other royal family like Spain, Russia, and Germany. So that's why this hemophilia is also called as royal disease. So, what is the definition? Simple definition of hemophilia is the ability of the blood to clot is severely reduced, causing the sufferer to bleed severely, even a slight injury due to a lack of factor 8 and 9. So, it is a condition where there is a ability of blood clotting will be reduced, and it happens because of the lack or genetic defects in the genes which makes the factor 8 and factor 9 of blood clotting. We have already studied in HAP regarding the mechanism of blood clotting, where we studied about factor 13. There are 13 factors which helps in the blood clotting. So out of that 13 factor 8 and factor 9s, if it is lacking, then it leads to condition hemophilia. It is also defined as impaired hemostasis. Hemo means blood and stasis means stop. If there is impaired in flow of or clotting of blood, then, and if you see the term hemo means blood and philia means love, lust. It does not mean that the people gets vampire and they start loving the blood and become lust for the blood. No, this is not the one. It is the condition where the ability of blood to clot is reduced. And hemophilia can be two types, hemophilia A and hemophilia B. So hemophilia A, if you see, hemophilia A and hemophilia B, and some books they have also mentioned third types, that is called von Willebrand disease. Three types. So in hemophilia A, it is mostly found 80%. It is because of the lack of factor 8. Hemophilia B is because of the lack of factor 9, and it is 15%. Von Willebrand disease is due to the lack of von Willebrand factor, which is found in 5%. So hemophilia is actually the most common, and this hemophilia, the disease is itself a rare disease. It's a very rare disease found in 1% of out of 10,000. And this hemophilia is a X-linked recessive disorder caused by deficiency of functional plasma clotting factor 8. So 8, if there is lack of factor 8, then it is hemophilia A, and which may be inherited or arise from a spontaneous mutation. Means if the parents is having the defects in the genes which forms factor 8, and if keep on passing to their offspring, that is called inherited, or it may be arise in any of the person because of this mutation of that gene which forms factor 8. And the development of inhibitory alloantibodies or autoantibodies to factor 8 can complicate the treatment of genetic cases. And rarely development of autoantibodies to factor 8 results in acquired hemophilia. Means sometime what happen, your own immune system will form autoantibodies and it can destroy this factor, that can also leads to hemophilia A. Etiology means what is the reasons for this? The reason for hemophilia may be hereditary, means it is passing through generation to generation because of gene defects. Then it may be because of liver disease. If you have some liver disease, because we know that these are the factors. Most of the factors of blood clotting are synthesized in liver. So if you have some liver disease, these factors will not able to synthesize. Vitamin K deficiency. Vitamin K, you know that also helps in the synthesis of prothrombin and helps in clotting. So if there is vitamin K deficiency, then it can leads to hemophilia. And finally, the mutation of gene. That gene which is present on X chromosomes, which is responsible for the synthesis of factor 8 and 9. If that genes undergo for mutation, then that will, factor will not be able to synthesize and it leads to hemophilia. Sign and symptoms of hemophilia means obviously the major sign and symptoms will be uh, hemorrhage, means continuous small cut leads to heavy bleeding, hemorrhage. And sign of hemorrhage include the following and depends upon which area, which parts. Like in general, if you see this, hemophilia can cause symptoms like weakness, orthostasis, tachycardia, tachypnea. In musculoskeletal, that is joints, it causes tingling, cracking, warmth, pain, stiffness, and refusal to use joint. In central nervous system, it can cause headache, stiff neck, vomiting, lethargy, irritability, and spinal cord syndromes. In GIT, it can cause hematemesis, melena, frank red blood per rectum, and abdominal pain. Here, hematemesis is nothing but it is a blood vomiting. Melena is nothing but black tarry stools containing a small amount of blood. Frank red blood per rectum means passing of blood in stool, and abdominal pain. Genitourinary means related with the reproductive and urinary systems. Hematuria, that is the blood in urine. Renal colic, that is pain in urinary system. And post circumcision bleeding. Post circumcision bleeding means that the removal of foreskin of penis, if that generally in Muslim community, the penis foreskin is removed, so that time it can leads to bleeding. Other symptoms may be epistaxis. Epistaxis means nose bleeding, oral mucosal hemorrhage. Hemoptysis means coughing of blood. Dyspnea means difficulty in breathing. Hematoma leading to airway obstruction. Hematoma means a solid swelling of clotted blood within the tissue. Excessive bleeding with routine dental procedures. So these are some signs and symptoms related with hemophilia, where it causes heavy bleeding and which area involves leads to respective sign and symptoms. If then types of hemophilia, generally we have two types of hemophilia. Hemophilia A, it is due to the lack of factor 8, and hemophilia B is due to the lack of factor 9. Factor 8, if you remember, it is also called as anti-hemophilic factor. Why it is called as anti-hemophilic factor? Because of this, if this factor is not present in the body, then it leads to hemophilia. And this hemophilia A is also called as a classical hemophilia because it was discovered first. Hemophilia B is due to the lack of factor 9, and factor 9 is also called as Christmas factor. That's why it is also called as Christmas disease. So there are two types mostly, but in some books you will find that they have given the three types of hemophilia: hemophilia A, hemophilia B, and von Willebrand disease. So hemophilia A is X-linked recessive, and hemophilia B is also X-linked recessive, and von Willebrand is autosomal dominant. Means for this the genes are present on X, and it express only when it is in the form of recessive forms. And one more thing I want to explain about hemophilia is yeah, generally what happen in hemophilia. mm this is the female carrier where one X chromosome is having mutated gene which is represented as XH, and X is a normal, and this is the male X, normal male X, and Y. So in this hemophilia, the female is always carrier, and male is the one sufferer, because the female is having one X hemophilic gene, and another is X is a normal. So this female is a carrier, and they don't have any symptoms because one X chromosome is healthy and have anti-effect of mutated X chromosomes and suppress the effect of hemophilic chromosome. That's why the females do not get this disease. Female can get they are very rarely if this XHY get married with XHX, then this XH, then their daughter will have this condition XH and XH. This is the hemophilic female. So for female that has to be recessive, means this has to be present in both, then only the hemophilia will take place. But for female, for male, we have only one X and one Y. So if XH only can leads to hemophilia. So the male is the sufferer of this hemophilia. So this is X link of because of the lack of factor 8. Hemophilia B is because of the lack of factor 9, and von Willebrand disease is because of the lack of one factor that is called von Willebrand factors. So now the next important part of this is to understand the pathogenesis or pathophysiology of hemophilia. So here the main events is to understand the clotting cascade. First is von Willebrand factor. So what is von Willebrand factor? It is a factor which is important in platelet adhesions to wound sites. So if this factor is absent, then there will not be platelet adhesions, and bleeding will be continue. It also helps in the binding. It binds with factor 8. So binding with factor 8 as well as platelet adhesion is the important function of von Willebrand factor. So if this factor is absent, so it can lead to hemophilia. But the main thing is to understand this clotting cascade. This is the main in the exam you have to draw this, and for the student who understand the clotting mechanism, this topic become very easy, because this clotting mechanism take place because of primary hemostasis and secondary hemostasis. Primary hemostasis is nothing but it includes that whenever some bleeding starts, that at that place the first things happens is that vasoconstriction will be taking place. Then von Willebrand factor cause platelets to aggregate at at that place, and for some time it act as a barrier, and after that the clotting starts where the fibrin and all comes and cause blood clot to form. So primary hemostasis and secondary hemostasis. Primary hemostasis involves the platelet aggregation to form a physical barrier, whereas secondary hemostasis involves the activation of various clotting factor, and finally to form a fibrin which forms the clot. So let us understand how this clotting take place. So whenever there is some vascular damage or tissue destruction, then it leads to the release of a factor that is called as tissue factor, and this tissue factor converts factor 7 to 7A, that is activated factor 7A. Then this activated 7 factor A along with tissue factor, it forms a complex, that is tissue factor and factor 7A. This complex then will activate the factor 10 to activated factor 10A, and this activated factor 10A along with activated factor 5A will activate prothrombin into thrombin. Prothrombin is also called as factor 2 and activated is called as factor 2E. Now this thrombin will act on plasma protein fibrinogen, which is soluble, that's also called as factor 1, and this fibrinogens will convert into fibrin in the presence of thrombin. Thrombin also converts factor 13 into activated factor 13A. Then this factor 13A will act on this factor 13A and fibrin monomer, fibrin cross link with factor 13A and form a stubble clot. So this way the clot take place, and this is the part of clotting mechanism which is also called as extrinsic pathway. Now we have another pathway that is called as intrinsic pathway, and in this pathway what happened, the factor 12, when it comes in contact with the collagen, then it gets activated and become factor 12A. This factor 12A activate factor 11 into 11A. This factor 11A will activate factor 9 into 9A, as well as factor 8 get activated into factor 8A with help of proteolytic cleavage. Then this factor 8 get converted into factor 8A. So this factor 8A and factor 11A activate factor 9 into factor 9A. Okay, so this is the step which comes under the intrinsic pathway, and this factor 9A again activate factor 10 into 10A. So this is the steps which belongs to both extrinsic pathway as well as intrinsic pathway. That's why this steps is called as common pathway. In common pathway, it starts from the activation of factor 10 to 10A. So in extrinsic pathway, the factor 10 is getting activated because of the tissue factor and factor 7A complex, whereas in intrinsic pathway the factor 10 is activated because of the activated factor 9A. So both extrinsic and intrinsic pathway is activating factor 10, that is important, and factor 10A along with activated factor 5A converts prothrombin into thrombin. Then thrombin will act on fibrinogen and it will converts into fibrin. Thrombin also convert factor 13 into activated factor 13A. This fibrin and activated factor 13A cross link and forms stable clot. So this is the whole mechanism involving primary homeostasis, secondary homeostasis, extrinsic pathway, intrinsic pathway and common pathway. So this is the way the blood clot. So in after drawing this mechanism, what we need to do is we have to mark here factor 8 and factor 9. This we have to circle, and we have to say that this is the factor which lack, and because of the lack of this factor 9 and factor 8, we get a condition that is called hemophilia. So this topic become very easy for the students who understand well the mechanism of blood clotting. Simply you have to circle the factor 8 and factor 9, because hemophilia is the condition which take place because of the lack of this factor 8 and factor 9. If the factor 8 is lacking, it is hemophilia A. If the factor 9 is lacking, that is called as hemophilia B. So this is the mechanism that is pathogenesis. Then first heading, the pathogenesis will be discussed under three headings. First is von Willebrand factor, second is clotting cascade, and third is genetics. So in genetics, we have to just write a few points. That is the gene for factor 8, that is F8C, is located on the long arm of chromosome X within the XQ28 region. So approximately 40% of the cases of severe factor 8 deficiency arise from a large inversion that disrupt the factor 8 gene. So here genetics, they try to explain that hemophilia is taking place because of gene mutation, the gene which forms factor 8. So the 40% of that happens by a type of gene mutation that is called as inversion types, whereas 60% of gene mutation is a type that is called as deletion mutation or insertion mutation or point mutation. So the genes F8C, which is present on the X chromosomes, which forms these factors. So if that genes undergo force mutations, so the 40% chance of that mutation is by the type of mutation that is called as inversion mutation, and 60% it involves chances the type of mutation that is called as deletion mutation, insertion mutation, and point mutation. So this is the 5 marks questions where you are going to define it. Then you are going to write the etiology, or going to write the symptoms and types, and finally the pathogenesis. Thank you.